Hey guys, John Faulkner here with Survival Dispatch, and I don't have just one of my amigos with me today.
I didn't know we were
I got
starting.
two. Oh, Chris hasn't been here for a while. He forgot how this works.
I've been playing hooky. Been building an office, man.
How was everything, sir?
Good. Got the office done. Just about almost 100% done.
Yeah.
But yeah, it's nice. It's nice to have a place to
You
go.
want to talk about other projects you've been working on?
Tactical walls are up. TV show, working on TV show, working on more books, working on stuff.
Yeah.
I mean, just staying after it. Even as the world ends, I'm still at work.
So,
I'm working on my COVID-19 vaccine, but that's taking longer.
it takes a little while. All right, so I got Charlie on the computer right here. I got Chris Weatherman next to me. I got Nikki behind the camera.
What's up?
And Allie's on the computer as always, making sure you guys get your questions up for us to answer. So here's what we're doing today. Like the last couple of weeks, we're going to talk about COVID-19 and just kind of some of the updates. Has it been a week, Charlie? It's been a week. A week,
Yeah,
Nikki?
it's
We
been
did it
about a
last
week.
Thursday. Yeah, 1 week. So 1 week ago, we did a live. Huge response, hundreds and hundreds and hundreds of people.
Did you guys keep the
Tons of
numbers
watching.
from last week, 1 week ago? Do you have those?
Nikki could probably pull up some
have the
numbers for us.
Well, I was just curious because I've been watching them, but
Yeah.
I'd like to see exactly last week's totals against these. It would have just been interesting to look at.
Yeah, we'll see if we can find those. So,
Yeah.
as always, guys, make sure that you guys leave your comments down. Make sure you like this video so it hits reach so that people know. Also, we try to always do our lives on Thursday, but with just conflicting schedules with everything that's going on, we're doing it Thursday this week. And I'm so glad that Chris was up here. Charlie's here also. Charlie's got his little man with him, even though his little man right now has his pacifier. Charlie, you can take that back. There you go. Good job. But, so we're going to go over just kind of what we've kind of been going through the last week or so. Oh, don't make him upset now.
Don't release the Kraken, dude.
But we're going to talk about what
I don't
we've
wanna pull
gone
the
through
pin
the
on that
last
grenade.
week. Charlie has some cool insight on things that he's been working on with his CERT team. Chris has been in communication with a lot of people. I will give some insight as to what the gun industry is doing. And then Nikki has some further communication stuff that we're going to talk about as well. But as always, guys, make sure that you guys are putting your questions in, and we will make sure that we get to as many as possible. So that is that. We appreciate each and every one of you guys that are listening. So before I start, just so you guys know, we're not medical profession lawyers, anything like that. So we are just people that are giving the stats that are spread out across the table and our opinions. So we're going to jump into the first question here. Brad wants to know, how best to quarantine every time I step back into my house to best protect my family?
Oh,
You want me to start?
Well, I'm
So-
going to do a post later that was sent to me by a military biochem warfare guy. He gave me like the decontamination protocol, and for this,
Yeah.
it was very lengthy. I will post that on
So-
my page later today.
So
It's
here's
over the top, but you guys
here's what I've been doing. First of all, I've pretty much only been wearing one pair of shoes, just in and out of the house from the office and things like that. When I walk into my front door, I take my shoes off. I just leave them outside for now. I take off my shirt, my pants, everything. I throw them straight into the washer, and then I go take a shower. I dry off, I take that towel, I throw it into the washer also. If I've picked up my son, I'll do the same with him. I'll
Throw 'em
strip
in the
him
washer?
down, I'll throw him in the washer. But we take all of our clothes that we've brought inside with us, we throw them straight into the washer. They don't go into our hamper, they don't go across our house, I don't go lay down in the bed or anything like that. I strip down, throw it all in the washer, take a shower, throw that towel in the washer, and then I run it on the sanitation cycle. I put clean clothes on and I go from there.
I haven't been leaving the house. I mean, that's the first time I left my house in like a week. So
Yeah.
I don't have a protocol.
Charlie, anything you want to add there?
No, a lot of hand washing, but the right kind of hand washing,
Yes.
including, whenever you have to run out, like we've been lucky haven't had to really go out for much of anything.
Yep.
But when I do, I treat everything I touch as if it were contaminated, and then use a lot of hand sanitizer out in public.
Yeah, I agree.
But otherwise, I'm bailed in.
You want to take the next one?
David, it says, how serious is the threat, or is the government lying to us as they normally do? Well, looking around the world, this one seems fairly contagious.
Legit. Yep.
It's definitely highly contagious. That we know for a fact. It's not particularly deadly because it wasn't designed to be deadly. It's designed to be highly contagious, which is what it's doing. So if you are of certain risk factors, you know, age, obesity, you smoked a lot, you have a compromised respiratory system, other comorbidity factors, then yeah, you got something to worry about. Most people, it's like the flu, and it doesn't even last as long, I don't think. So,
right.
you know, but no, I take it serious. It's here. We're seeing it spreading around the country. So I'm just taking precautions.
Yep.
But my precautions mainly are I'm just not leaving home. When I go home, I stay inside the gate. I got plenty to do there anyway.
Yeah, yeah, I agree. Can we bring the screen up just a little bit? Can you get rid of the underline?
Anthony, we are social
yeah.
distancing because we have Charlie on a remote monitor.
All right.
He's not even
Backward
allowed
wants
here.
to know, I live 80 miles away from work and nobody in my family is around people. Should I still be going to work or should I just stay home until this ends? Well, the hardest part about that question there is we don't know when this is going to end.
No, we don't.
So it's kind of hard to just say on April 1st you can go back to work or next Friday or...
And can you afford to just say, I'm not going back to work till this is over?
Yeah.
That's another real big one.
Yeah. So, I mean, you know, and it's a difficult situation right now. I would just say make sure that you have a bag packed to where if anything were to happen, you're able to get home from those 80 miles if roads were to be closed down or anything like that, and to do your best. So, Charlie, you want to add anything to that?
No, man, you guys got it.
So, Jack wants to know, is there anything extra to add to your bug out bag during this pandemic? Charlie?
Yeah, I did a video on that called the Bug Out Bag Pandemic Enhancement.
Yeah,
and based
Nikki,
on
and Nikki will leave a link to that.
Okay, yeah. So based on the theory that you're out and about, or you get locked down somewhere that you are not at home, so you'll have your regular bug out bag stuff. But I would also say pack for like an overnight trip or several overnights. Just throw a supplemental bag in there with your additional toiletries, water, food, hand soap because your hand sanitizer will run out, and washcloths, some towels, you know, and some general items like that, and then beef up your communications plan and let the people that you would be communicating with know where you are and maybe even your remote relay contacts. So when we do a commo plan, we have to call somebody out of state in case somebody's looking for me. They should all call you, that kind of thing.
Right.
So that's the enhancement I would recommend to get started. But check out the video.
I agree. Anything you want to add to that, Chris?
You know, if you're going to be out in public too, if you can find the proper types of N95 masks, and by that I mean ones labeled bio level 1 or 2, not just the ones from Home Depot, you might consider adding some of those as well. If you think you're going to be stuck in a crowd, like if you're forced to travel or walk with a group someplace or ride a bus because you're, you know, whatever's happened, you might want a proper N95 mask. But again, if they're not labeled bio level 1 or 2 and medically rated, they're useless, folks. There's no sense in buying them or wearing them. They're not doing you any good. There is a little bit of evidence that says if you put some of the regular dust mask style things on the sick people, it can reduce the potentials of contamination. Yeah. But the mask you wear has to be able to filter to 0.01 micron. That's the same thing our water filters do, guys. It's the same thing. Virus is a virus, same size, 0.01 micron. The stuff you buy at Home Depot is like 2.5 microns. So as you can tell, they're going to get through.
Yeah. Nikki, you want to add anything?
No, I mean, the problem is now is finding the darn stuff.
Yeah.
You know, you just can't get it.
Yeah.
So
I agree.
I can add to that only in saying that the I believe it was 3M has been authorized in more than just, I believe it was 5% of their basic mask stock to be allowed to be, they lifted the liability regulations on masks so that construction masks, if it's labeled as a N95, it will work. It's just not medically certified. So it's still the same filtration, but it goes outside of their liability and insurance issues.
Again, to me, talking to somebody inside the CDC, if it's not a 0.01 micron, which is what your N95 medical rated ones are, it's not going to work. And that's what you need to look at. Yeah. Unless they're sticking a 0.01 micron mask in a 2.5 micron mask bag, because that's what they have. But, you know, you would think they'd be better at telling you or informing you of that.
All right. Well, next question here, Michelle, because this kind of goes along the line. If the streets became unsafe, what can I do to try and keep bad guys away? I'm old and I cannot get away. So,
all men were created equal. Smith & Wesson changed that.
Michelle, I would first say, just make sure you don't, even if you are elder, try not to stand out. Try not to be an easy target looking. Don't walk down the street, carrying bags of groceries or anything like that can make an easy target where people think they can get a quick gain off of you. And it's difficult too, because a lot of times I would say, try to walk kind of near people. Even if you don't know them, just kind of walk near them, because if there's 3 or 4 people that
try and look like part of a crowd.
Yeah, just look similar to part of a crowd, even if it is 3 or 4 feet away, or 3 or 4 feet, 5 feet, 6 feet, whatever you want it to be, in front of somebody. At least at that point, you're deemed a herd.
Yeah.
And also, keep your head on a swivel. Be looking around, always be observing what's going on, have situational awareness, so that nobody can just, come up from your blind side or anything like that, attack you from behind. Try to, avoid choke points and things like that. There's quite a few things you can do, but the biggest one I would say start with is, start with not looking like you have something that can be gained by an attack upon yourself. And try to stick around others.
One thing I'll add to that is if you're not physically capable of defending yourself and you are attacked, give them what they want real freaking quick.
Yeah.
Don't try to resist them. If they want your purse, give them your purse. You can get another one. If they want the groceries you're toting, let them have it. It's not worth risking severe bodily injury or potentially death over. So
you can take the next one here.
Wait, sorry. Well, I don't know this one. I was looking at this one.
Just to
I
say,
don't know how you
Charlie
say
might know it.
PAUG?
Yeah.
PAUG? I don't know. Recommended brands for UVC wands. Most are back ordered, but there are some out of Canada. Charles, is that something you got anything?
The UVC wand. Well, yeah. There's a piece of equipment that's got a UV bulb in it, but it's a UVC rated bulb, and you can wave that over things to try to sterilize surfaces.
Doesn't it take minutes though?
Yeah.
Like most of them are like boxes that take like 5 or 10 minutes to do a phone or something.
Well, yeah. So the big thing when it comes to UV radiation is the dwell time.
Yeah.
It's very similar to the concept of doing solar disinfection for water. If the water is very turbid or has a lot of particulates in it, it's not going to be as effectively cleaned by the sun.
Right.
So because you're not seeing it all and it's too cloudy. So same thing with a wand or a light or air going through an AC unit with a UV bulb in it. If it's not in there, if it's not exposed long enough, you may not get that. And those bulbs have a lifespan. So you'll see them in fish tanks.
Yeah. And
those bulbs will actually start to dim over time, and you won't know necessarily when that is and then when they go out.
Yeah.
So.
Yeah, I've used quite a few different UV pens, like SteriPens and stuff for water filtration while hiking. It takes multiple minutes to just cure like a 2-liter Nalgene. It's not a. Don't think that this is like a Harry Potter wand. Yeah, exactly, just like what Charlie has here.
This is a SteriPen.
Yep.
My assistant here is a little squirrely, but so this is what a SteriPen looks like.
Yep.
And you can take this cover off of it, and inside of there is going to be a UV bulb.
Yep.
So
it's kind of hard to see, but yeah.
Yep.
Yeah, but it takes multiple minutes. This isn't like a Harry Potter wand where you can just whoop, and
no.
your house is now clean.
Like Charlie said, there's dwell time. It has to be exposed for a certain amount of time.
So they always worked well. I mean, for water when I used them. For these, there's things. Nikki, if you can find it, I know they're back ordered. It's like something soap, soap box, something like that. It's a UV light that I've been using for my phone. So I take all my EDC items out on one table at my house when I get home. I take everything out of my pocket, and then everything goes from the left side into the machine and out. But it takes me about 40 minutes. I got to do about 3 or 4 different stages.
It's called phone soap.
Phone soap, yeah. And it seemed to have worked pretty well. And I know they're sold out everywhere, but I've used one and it seems to work. So, all right, Dominic wants to know, work for a water company in Michigan. They have me deliver to a cancer hospital downtown directly. Do I tell them I'm not doing it anymore and risk losing my job, or keep doing it for a paycheck?
Can you afford to lose your job?
Yeah, that's a difficult one. You know, cancer hospitals down. You know, I wouldn't feel too bad if it was a cancer center. Those are usually some of the cleanest places you will ever find, because you know, people that are going through chemo and stuff like that are beyond susceptible to, I mean, the common cold,
everything,
let alone anything like COVID-19. They're usually beyond sterile, because that is, I mean, they're trying to make a sterilized bubble for these people to go in to try to get better. So me personally, I'm not giving legal advice or life advice. I'm just giving you facts. From what I've seen, my mom's gone through chemotherapy and stuff before. The places are usually they're not a normal hospital. You know, they are a specialized facility and are usually immaculate and sterile. Yep. So that's all I got. Nikki, your wife works at a hospital. Thoughts?
So she's basically the generalist educator. So she works with the CDC, gets the new intel in, puts it out that day. It's an ever-changing process. Today it's this, tomorrow it's that, the next day it's this, and the quantity of what they're offering is slowly less and less and less. Today it's you have to have this. Tomorrow it's you're okay to get by with this. The next day it's well, you know, if you can. Yeah. Just because of supplies.
Yeah.
So it's an ever-changing thing. That's for sure.
It's like the whole N95 mask thing. You know, I've been telling people I have access to these masks if there's hospitals that want them, but the price, it's like trading on the commodities market. When I first started this, masks were $3.30 a piece. Today, those same masks are $7.30 a piece, and there's only 2 million of them available, and you have to buy 1 million at a time.
And also, did you see that like Apple just donated like 8 million N95 masks?
Yep.
So what was Apple doing sitting on 8 million N95 masks?
There's wildfires in California because of smoke.
Yeah.
That was for their employees.
Okay.
So, just so you know, Chris bought us some homemade biltong that he made. So Nikki is eating some right now. So every time he gets a huge mouthful of it, I'm going to throw it to Nikki just so he has to try to choke it down and answer the question.
Okay.
Charlie, we'll send you some.
Outstanding. I was just going to say.
It's really good, too.
All right, Nick wants to know, going back to the question here, unemployment rates are through the roof, impact our society, security, and et cetera. Yes, they're going to.
Oh, yeah, it's obviously impacting society, but of course, you know, helicopter money's on its way and everybody's getting a check.
When do, Charlie probably knows this, Charlie, when, it's in the next couple of days, when do the latest unemployment rates get released?
They just came out at 3.
Okay, it was. I knew it was like
Yeah, it was.
This morning or yesterday.
3.3 million new claims yesterday, I think, was what they released.
I think so. Yeah.
Yeah. So.
And we have this. Nikki, can you put that chart
up right now?
Okay. Yeah. This chart is staggering. How you can even see since Trump has been in office. I mean, since the peaks of the recession in 2008.
Oh, it's just a vertical line
and
here.
Guys, listen, it's one of those things here where Nikki and I live. Small businesses have been, you know, pretty much closed down. Here at Big Daddy Unlimited Survival Dispatch, we've been treating our employees here to lunch every day. We keep going to just small, you know, local restaurants to try to help them however we can. I encourage you guys to do it as well. You can bring your food home. You can, you know, as long as there's no metal in it or plastic, you can throw that stuff in the microwave, zap it for, you know, 20, 30 seconds. It'll be sterile. It'll be good to eat. But, you know, small businesses are hurting. And
a lot of small businesses now, too, are doing really good deals where, you know, for takeaway because they need the business.
Yeah.
They're not getting it.
Yeah. And I feel extremely confident in how the small businesses are preparing their food now, their employees. A lot of them are going to just drive-through and curbside.
Well, this number 2 is a bit of a kind of a stark reminder of what our economy is based on nowadays. Yeah. So what's been hit the hardest? Service sector jobs. Yep. Restaurants, hotels, the theme parks, obviously, things like that. That's the people who are losing their jobs right now. You know, the guy delivering water to the hospital, the cancer hospital, he's still got his job. Yep. The people hauling fuel trucks have still got their jobs. it's the waiters, waitresses, housekeepers, entertainment, all that kind of stuff. But look at what that does to our economy when just that sector, because there isn't much of a manufacturing sector. There's still some, of course, but
on the other side of that, so I'm involved in the other side of that a little bit. In our meeting that we had yesterday, there is a see something, say something process in place now. If bars are serving and not managing their distancing,
right,
as is required under here in Georgia, we had our governor, told no more than 10 people, 6 feet apart, and all that stuff for restaurants. Some restaurants have already been, ratted out by people, and they'll be shut down. So in Los Angeles, the mayor came out and said, if you're not going to observe the shutdown, orders that we've put out, we're going to shut off your water and your electricity to your business.
There's been one arrest, I think, in Los Angeles. It was too, where a restaurant owner was arrested, or I think it was LA.
I think so.
And that's starting to get a little bit more common because they're doing everything they can to stay in business.
And
you can get curbside alcohol.
Yeah, so. and I mean, you can see this too. And I mean, we all love Mason here. But kids being at home, parents, and I know a lot of people that have just had to leave their job, take leave, because they have kids that we can't go to school. Somebody has to watch them. Charlie's kids are usually at daycare right now, and being watched by people that don't have a job right now. And so that then puts even more pressure on people that are still having to work.
And there was a whole discussion about that around like the daycare. The people were like, why are daycare still open and closing schools? And the argument to that was, well, our doctors, our nurses, our EMTs, firefighters, and police officers rely on that service. And if their kids have nowhere to go, they got to stay home.
Yeah.
So it's kind of a catch-22.
Johnny wants to know, are the hospitals waiving the cost for COVID stay in the ICU? I don't know. Nikki, you might be able to, I don't know.
I think that's a case by case.
Yeah, that might be a locality by locality. I know they're saying now the test is free.
Yeah.
It depends on what county and who's backing it.
I've heard a little bit of some absurd things about the test too. I know for a fact that the test, the actual kit, the test costs $22.
Right.
Then there's the lab work and stuff behind it. But I've heard that some places charging people, when they were charging them, as much as $280 to get a test.
Well, remember what we talked about, before we went on, that I got information from the nurses that were saying that there's 30% false negative.
Right.
So if you have somebody that that's getting the test and they came back negative, there's still a chance that in 30% of those cases that it's really a positive.
Mm-hmm.
So now in our area, we've got some stuff set up. It's not released to the public yet, but there are some places where you can go to get your testing done, but you're not allowed to show up there without a number showing that you already had been screened. That says then you can go, then you can get your test, and then go from there. I know for a fact that we've got key people in our area here. I'm trying to be vague because of my connection to the business, to the government, but that has taken 10 days and they still do not have results back from the test.
Yeah.
Wow.
And these are people that when they come offline have a dramatic effect on the operation at our county level.
Right.
Yeah.
And I mean, you got things like, I had surgery on my arm. I had some mass removed that are getting tested to make sure there's no cancerous parts of it. But they told me just due to the current circumstances, it could be 3 to 6 months before I saw the results back. Because everybody, and I'm okay with that, because everything COVID-19 related is getting priority. But there's still a lot of testing. I mean, there's still people that other sicknesses, diseases, and illnesses did not go away.
No.
So I know our healthcare worker, our nurses, our doctors, you guys are amazing. I hope you guys stay healthy so that you can help those that need help. So yeah, it's just difficult. Grieper wants to know what should we look at for stats? Death versus recoveries, death versus active. What should we really be looking at stats-wise? I mean, we have all these papers laid out. Charlie?
It's death. And the only reason it's death is because death will definitely be reported, and death can be extrapolated from the number of infections, Whereas positives, we don't know the true amount of positives due to the lag on testing going forward.
Well, what they're asking is do you do it as death
Like
versus
what ratio?
total confirmed or death versus total recovered?
Well, as death as in total confirmed, well, as total estimated. So based on the number of people that have passed away, you can then extrapolate and say this is how many people we believe are in an area, because we don't have the forward side of that to say everybody has been tested, so now we know what the spread is.
Right.
So the way that you can determine a hot zone is what we're using those terms now. We actually are calling them hot zones.
Oh, yeah.
Or hot pockets. That's been used in certain areas. And because if you got somebody who's passed away, then you can say, okay, well, they had to have had it for roughly this period of time before they passed away, and then they that would have allowed this much spread within that area. So that's why death is the number.
Okay.
Yeah, I would go with that. And Nikki, if you can put the stat up for U.S. So total.
So remember we were talking about the difference. Last week, we aired this on the 19th. We were at total confirmed 229,390.
229, so up
We're
about
at-
260. I'm
Yep.
just using rough numbers
And
here
the deaths, we were at 9,325.
We've
and
more
now
than
we're at
doubled that.
22,000.
22,000.
Yeah, we're almost triple.
So,
Been up on triple.
and again, if you look at this next graph here, this guy shows pretty much the growth rate, and it's pretty much a hard wall.
Yeah, it's a vertical.
Yeah.
Now, if you look at just the U.S. numbers, we got 69,000 as of today. 69,000 confirmed cases. But let's put this into perspective again. Let's try to stay glass half full, unless you live in those states. There's over, I think, 33 or 35,000 in just New York.
Oh yeah, they're over 50%.
And it's over 50,000 of the, I'm just going to call it 70,000, 69,000 are New York, Washington, and California.
Yes.
So I mean, it's 80% in what what Charlie was just talking about, hot pockets.
Well, and too, what are those?
Louisiana, New Orleans is
New Orleans is
making a
catching.
run
Yeah.
for the end zone there.
Dade County right now is considered a hot zone, as is Broward. They're both they're on the hot zone list at the moment. Red zones, they're calling them in Florida. We have, I think, in my county and Lake County, 14 cases. What do you guys have here in Alachua? Do you know?
I think it's at
Confirmed
35.
cases or deaths?
Cases.
Cases, I mean, it's like 30 something.
Yeah, it's mid-30s.
Yeah.
Okay, so we had like 14 cases.
And Alachua County is big.
Yeah, but it's rural.
Where we live.
It's
It's
very
rural.
So you're
Yeah.
seeing these high concentrations in places like New York, Seattle, L.A., New Orleans, Miami. Why? Population density.
Yeah.
Our good friend Alan Kay, something he always talks about, and when he's doing an evaluation for something, he always talks about population density and the problems with that. And case in point, right now.
Yeah.
So the denser the population, the faster stuff's going to spread. So just the way it works out.
But it also has a lot to do with the people that are not listening and following along
Right.
with the suggestions to stay home.
Right.
They're thinking this whole thing got bungled in the beginning because everybody said it's not as bad as the flu, and that's stuck in people's heads. And that's why the public information sources have to be proactive, and there's a balance. It's just like evacuations for hurricanes. There's always one person who has to make the call whether to make a community evacuate or shelter in place, or when to evacuate based on clearance zones. And that's the emergency manager. That's the worst job to have, because if you say it too early and nothing happens, nobody listens next time.
Yep.
If you say it too late, they blame you and it turns into Katrina. So that's the same kind of thing with this, but we're in a bit of an uncharted territory that the country wasn't prepared for.
Well, that's just like did you guys see the Change.org petition for Florida? 75,000 people signed a Change.org petition demanding that the governor shut the state down.
And it still hasn't. Yeah.
Why don't those 75,000 people just quarantine themselves?
Exactly.
If you want to be quarantined, you don't need the government to tell you to quarantine yourself. Just go damn do it.
Yeah.
This whole thing of, the government has to fix it and the government has to solve it. That's why we're in most of the conditions we're in this goddamn country.
And you got to be careful. If you ask for help, you might not like the help you get.
Yeah, be careful what you ask for. Yeah, exactly. You quarantine yourself.
So
Camille's asking,
we're moving on because, woo!
Yeah, well, that one makes me mad. The stupidity, it's beyond. I can't. Never mind.
Charlie's so boring, he's putting his son to sleep right now.
Yeah.
Good gracious.
So Camille says, guys, do you wear gloves going out? I don't.
I have not.
I wash my hands when I come back in.
Yeah.
I keep hand sanitizer in my truck, even though it's useless, but I keep it there. So.
Yeah.
No, but carry your hand sanitizer with you, and carry your mask, on you.
Yep.
So that if you got somewhere and things got a little squirrely, you could just put it on and wash your hands.
Yeah, I agree. I have a pair of gloves in my bag. If you wanted me to show you, I have a pair of gloves in my bag and a mask, but I haven't pulled it out and put them on yet. But I also haven't been, circulating the city. Going through businesses.
Like I said, I'm not.
There's not much left open.
I'm not going anywhere.
And let me say this. Now I'm taking a sample size of one pretty much, but I went to the grocery store yesterday, just needed a couple things. And how Publix is running in Florida, I don't know if it's everywhere right now, but where I shop, it's one person per 1,000 square feet of the store. So in our store, they limit it is like 52 people. And it's just a line outside, everybody's 4, 5, 6 feet apart. Just kind of down the sidewalk. When one person comes, it's like nightclubs when you're back in college. One person comes out, another person can go in. But our Publixes 2 weeks ago looked like a tornado went through.
Oh yeah.
And sucked everything away with it. Now there was no, and this was yesterday, no rice, beans, or pasta. That aisle was pretty much empty. And then the paper goods, toilet paper, paper towels, Kleenex. Those were the only 2 aisles that were empty. Any red meat you wanted, any chicken you wanted, produce 100% packed, milk 100%, chicken, coffee, cheese, bread, everything else. Everything else was there, and ketchup was about the only other thing that was a little low. But that was it, But what I think they've done is they've been doing this now for 4 days, and the supply chain is starting to catch up.
Well, and I bet that with the markets, the way they've been reacting, the big sell-offs we're seeing and everything, I bet you companies like Kimberly-Clark, I bet you their stock's been going up.
Yeah.
all these paper product producers, I bet you their stocks have gone up.
Yeah. They're going to turn in some good quarters.
Yes, they are.
So, take the next one.
Says, Chris asks, what's y'all's thoughts on first responders running out of supplies? What would y'all do for dwindling supplies, as in masks, disinfecting supplies, etc.? Yeah, they're running out because, again, we live in a world of just-in-time inventories. You and I were talking about this earlier, and we're seeing the fallacy of that. Just-in-time works great when everything's working great.
Yep.
As soon as you got one hiccup in the chain, it all goes to hell. So that's why no one can get anything right now.
Well, you want the the information that I've got working in my capacity is that only 25% of the national stockpile has been trickled out to the local responders on our end, and which has really come up causing a shortage.
Yeah.
So local hospitals have put out on Facebook and social media instructions for people who are at home how to sew mask covers and personal protective equipment for the hospitals, and asking for donations from the public from your private home stockpile for people. So there's a shortage of large and extra large nitrile gloves. So I have some. So if our people are going to need them, I'm going to have to donate some of them and over.
Yeah.
But I'm also running an awful lot of people here coming forward, so I've got to be careful on where we go with that. So I got to be careful.
Yeah, and you also have companies out there, like in the firearms industry, like Blue Alpha Gear and Coltac. These are nylon companies that make belts and backpacks and magazine pouches and things like that. And they're actually coming together and trying to raise money and turning their operation into making masks to help first responders and police officers and things like that.
Nomad Gear started doing that. The guys that make all the chargers and adapters and stuff. They're totally turning around their manufacturing.
So I mean, I think it's fantastic to see hardworking small businesses once again, small business America coming together. But if you guys want to go to bluealphagear.com and I think Coltac or coltacgear.com, Nikki will leave links. You can make donations, and literally, I know these guys personally, like Kurt and the guys over there. They will make sure that every single dime, plus, they are stopping their operation
to make this
to
stuff.
make these. They're not like doing it on the side.
And
like,
they're going to give it away.
give it away.
Yeah, they're not going to make any money on this.
No, they're so unselfishness like that. These are awesome companies that we work with. So if you guys want to support them, you can check them out also. So here, you can take the next one.
Rob says, my local paint stores and coffee shops will not accept cash. Do you think we are going that way everywhere? I haven't seen it here yet.
Yeah, in Alachua County, we went to like 3 or 4 restaurants and none of them would accept cash.
Really? Mm-hmm. I know that in China they were burning their cash because they were claiming it was helping spread the disease.
Yeah.
And if you noticed with the helicopter money that's coming out, that will be done, I heard, electronically and on cards. And I'm curious to see when that bill is available to the public and we can actually read that thing, if there isn't something in there about that. Of course, they're trying to go that way, guys. That's their goal. They want that because it's more control, because that's one more button they can push to turn off your life. So, yes, they do want to do that. Brian
wants to know, a friend of mine is moving across the country. What kind of tips would you give her if you had to travel across the country? First of all, if you have any friends that are along the way, make sure that you have their number, their contact, their address, everything like that, to where if you were in the middle of, I'm picking a state here, pick a state, Arkansas? Arkansas. If she's driving across Arkansas and she gets stuck, but she knows somebody that's in Arkansas or has a friend or something like that, because they've closed their state borders, they're not letting anybody in or out, because Arkansas is a very small number of confirmed cases right now, that she would have a place to go and to settle in. I would try to take as many supplies as possible.
Yeah, I would avoid trying to go and spending much time in the stores. Pay for your gas at the pump.
And go.
Wear gloves when you do that. So when you're handling the pump and hitting that keypad, especially the keypad. And if for your bathroom breaks, run in, use the restroom. Wash your hands thoroughly with soap and water. A lot of people talk about hand sanitizer, and I've got some friends that work in the CDC. The one thing you will never find in the CDC laboratory is hand sanitizer.
Yeah.
They do not use it.
Soap doctors scrub up, not use hand sanitizer.
A surgeon scrubs before. Yeah. So soap and hot water. You're seeing on TV they're saying 20 seconds. 42 seconds is what the CDC recommends. Right. So sing a little song, do a little dance, whatever it takes. 42 seconds. Wash your hands, and then when you dry your hands, hold on to those paper towels and use that to open the door. And then pitch them into the can as you walk out. And when you hit the front door of the store, use your shoulder, your back, push the glass open, go out, get in your car, drive away, and again, try to maintain social distancing. Yeah. And like John said, if you take a cooler with some snacks and drinks and stuff in it, you can limit your exposure to standing in lines at registers or any of that stuff. And there's smart ways to do it, and that's some of the stuff I would recommend.
Yeah, I agree. Becca wants to know, I am currently pregnant and due in May. Congratulations.
Yeah.
That wasn't in there. I added the congratulations. Do I need to worry about hospitals being too full? Is there any chance that I'll be turned away or have to give birth at home?
There is a chance, actually.
There is a chance, but and Nikki can chime in here. For the most part, it
would help if we knew what state you lived in too.
Yeah, but for the most part, every hospital is set up with the pregnancy section is usually its own floor, and usually that's the last floor to go. Correct, Nikki?
Correct, and also they've also shut down all elective surgeries. So a lot of those areas that, if they were going to spill over people that had COVID, they would go into the areas where the people would have elective surgeries, not shut down the essential items.
Yeah, I just remember in Italy watching some of the videos, they had shut down all their ORs. They had shut down their cardiac units, their cancer units. They had shut down everything to move beds into to house people. So it could happen. One thing you may want to do, if you're concerned now, is in your local area, look up some midwives, touch base with one, have that as plan B.
Yeah.
Have a midwife on call so that should the hospital say, hey, we don't have a bed for you, you can't come here, then you can call that midwife, get her over there. They're professionals. They know what they do. They deliver babies for a reason. And, in 99% of births in this country, it's going to happen either way. You're not going to stop it when it starts. And babies were born without hospitals since the dawn of time.
Yeah.
So don't be too afraid of it, but find a midwife and have one.
Charlie, you want to add anything?
Yeah, I would say just like everything else in the question previously, I think they fall under the same line. Treat everything as if it could be infectious, and just don't touch stuff you don't have to. Don't get close to people you don't have to. And remember, all survival is physiological. And if you keep that in mind, you'll go a long way towards that.
Yeah.
Same thing with whatever I touch.
And Becca, we wish you the best.
Absolutely.
And please keep us updated, and we'd love to see pictures
Yes,
of
we
the
would.
little one when he or she is here. So,
Maybe we'll give them a little survival dispatch onesie.
you know. Hey, I am rocking
little
a
patch
new
for the beanie.
Survival Dispatch shirt today. This is our, what are we calling this one again, Nikki?
That's the urban to distressed. What do we call that one? Urban to
Is-
rural? I
Yeah,
can't remember.
rural to urban.
Yeah.
We also have this one,
Looks
which is
like
waterfall
rural
one's
to ghetto.
pretty
to me.
which is super cool. Kind of abstract SD.
like it.
We got like 4 new logos. They're going to be hitting the website here
Yeah.
in the next couple of days. So, but we're
check
excited
my
about
mailbox.
that. So, yeah, you got some.
I don't.
All right, Drew, how do you feel
Just
about
saying.
all the people that went out partying in Florida and New Orleans? What is your message to them?
You're
So,
stupid.
listen, I was driving in today. I had the radio on, and they were talking about like a 500-person high school block party in a little town, and I was like, I didn't even know there were 500 people that lived out there. First
Yeah,
of all,
right.
let alone 500 high school students. But they were having a big
Well,
block party.
they probably had several graduating classes involved
Yeah.
from the same school. I mean,
Listen, guys, you know, I think the biggest thing that they're trying to control first are the non-essential gatherings.
Yes.
You know,
like block parties,
like block parties,
spring break.
You know, things
Mardi
like
Gras.
that. Yeah, on the beach, things like that. That's the biggest way that we can reduce the spread of COVID-19. So, you know, I don't condone any of that. Like here at our office, we've spread everybody out as far as we could. Everybody has 6 to 10 feet here, you know, of working space. We've utilized storage rooms and things like that they're nice storage rooms, they're not like closets. But, you know, separating people as much as we can, where they're usually in pods of people, like our customer service and our sales team and our order processors, things like that are usually in pods where they're closer so they can communicate. We've spread them all out, you know, but as far as the partying and stuff, it's got to end for a little while.
Yeah, you know, use some common sense here. There's a highly contagious pathogen floating around. Why would you want to be jammed into close quarters? And I'm even seeing some local governments do some stupid things. Orlando International Airport had shut down all trams but one. And then on that one tram, they had closed all the cars but 2. So people coming in on inbound flights were crammed into 2 cars of a tram.
Yeah.
As this was really kicking off and getting moving, and it was a known thing at that point. So it was almost like they were trying to help spread it. But, you know, do your best to stay away from folks.
Take the next one real quick.
Helen says, if you have had COVID-19 and are tested later, very rural area, not testing for the last month, can they tell if you have had it? Charlie, you might be able to help here. I think there's 2 different kinds of tests. There's the one that will look for the virus itself, and then there's one that looks for the antibodies, showing that, yeah, you had it and you made it through it.
And you carry the antibodies.
We'd be lucky to get any kind of test that actually works. That'd be fantastic. But I think that they can tell that you've had it
Yeah.
through the test.
That's the antibody test, yeah.
So, but I haven't heard, because the testing has been so bungled so far that I can't even get any good answers on it here locally,
Yeah.
even at the government level.
Wow.
So, yeah. Brian wants to know, are there any highway pirates out there yet? I haven't heard of any.
I haven't heard of any. However, last week I did hear of a 4-truck Walmart convoy being escorted by state troopers. So they may be getting worried about it.
Now, and I mean, highway pirates, I haven't heard any yet. Now, a lot of towns, even talking to some local officials, they're being directed to not worry about small crime, pretty much. Theft, cars getting broken
Petty theft.
into, petty theft, they're not worrying about it. So, you know, is that going to be a moment of opportunity for some people? It's probably going to lead that way.
Well, talking to some of my law enforcement friends, I asked them what they were seeing, where they were seeing crimes increase. Number one increase they're seeing was commercial burglaries. So many companies are shut down, businesses are shut down, those are being broken into. The number one thing was domestic violence. The number 2 thing was commercial burglaries. The number 3 thing was car burglaries, and particularly cars with gun stickers, hunting stickers, anything of that variety on them, because people assume there's a firearm in it.
Yeah.
And a lot of places around the country are shutting down the sales of firearms, ammunition, and alcohol. So take that in mind. You know, Alan Kay, again, big buddy of mine, and this is something I do as well. I don't put stuff like that on my truck. I don't advertise those things, and this is why we don't.
Yeah.
So bear that in mind.
I agree.
Christy asked, what do you think about the article Chris posted on the New York nurse saying CPAPs could be possible in assisting people who are having severe respiratory issues? I don't remember posting that.
Because it has a positive airflow, you can get a little bit of forced air into the lungs. It's not going to be like a ventilator.
No.
But yes, there is that. It's also somewhat filtered, most of them.
Right.
So yeah, there's
as
a
long as you're cleaning your CPAP machine, which should be like nightly.
Yes, if you clean it, use the So Clean model. You know, that's got the UV sterilizer to it. But there's also a little filter to those. But you're not generally going to want to be sleeping in the same room as somebody who's infected anyway. So I think what we're looking at there is the positive air pressure portion of it.
Yeah.
B3 Outdoors wants to ask, I didn't have enough hand sanitizer. Have any of you found deficiencies in your preps?
You're always finding deficiencies in your preps.
And it's one of those things too where it is something, that's why I tell people all the time, like when we're talking like bug out bags, put the frickin' thing on and go out and hike for multiple trips and multiple weather conditions because you will find deficiencies, you'll find things that work or don't work. You know, part of the deficiencies I think we'd seen, like Charlie and I were talking about the other day with meat, freezer space. We would love to keep more meat. It's available. We would love to keep it longer, but like, hey, maybe I don't have enough freezer space. Maybe, you know, maybe we should add to this or that. You know, that was kind of one that I saw was, man, I wish I had another, you know, what do you call the lay down freezers? The
chest freezer.
Chest freezer. I wish I had, you know, a chest freezer that I could throw. Even if it was
vertical freezer's better. That's what
right.
I got.
You know, but even if
at the bottom of it.
Even if it was one of those things where like, hey, Nikki, do you guys want to go? You know, do we want to go 30% on one and fill it and have our own sections? You know, things like that.
I'm in with 3 other people right now on a full beef. We just bought one from the Umatilla FAA. The high school. We bought their cow. It's going to the processor, and 3 of us are splitting that up into our freezers. So you know.
And so I mean that's one deficiency that I've seen. You got any you want to share?
For me, and this was something that you know we haven't had to do yet, but if we have to, this is a deficiency we have, and that's shelter space for bringing people in to my home if I have to. You know, I went and relocated a bunch of supplies for some friends and all that live in some, you know, less than desirable areas if they're to be quarantined for a long period of time. And the plan was to bug out to my house. And, you know, find enough space to put all those people, that's a problem.
Right.
But, you know, really that's the only thing we've come up with. I mean, my preps leading up to this were a lot different than other people's. I ran out and bought angle iron and welding wire and rods and grinding wheels and stuff and lumber and screws and stuff like that and tar paper. So if I had to build things, fix things, if I'm stuck on my property for a long time, you know, pipe supplies. I was adding stuff like that so that should something happen to my house, I can fix it. So should something break over here, I can fix it. I can keep my homestead running. And of course, animal feed. We did a big stock of animal feed, and for us, I mean, other than we did a couple grocery runs too, but nothing extravagant.
I gotta be honest, you know, I follow, you know, what I preach about the 9 areas of survival, and I have not found anything that I would consider to be deficient because I've thought everything through and just in levels of depth for so long. So as long as we can, you know, not get foreclosed on and have a place to stay, we are probably good for the better part of a year.
Yeah.
Just because we've just consistently just lived it carefully, you know, over time. And, you know, we've always had we built what we laughingly call it the doom room, but it's just a big pantry, you know, with all different, you know, the tiered food storage. Everything from fresh to short-term, mid-term, long-term, and then made connections with livestock places, animal breeders, you know, things like that. If it ever got further, I could telescope my preps that way. But no, we just stocked up on additional meat, a whole lot of meat. We talked about that last week, because there's a possible looming shortage on meats and fresh produce.
Yeah.
coming up. But otherwise, no, we've been great.
Nikki, you got anything? And we'll move on here.
I think ours has just been the short-term stuff. You know, it's like we're good with the long-term storage,
Yeah.
but we don't want to break into that yet. So it's the, well, now we're going to need to go back to the grocery store and refill on the short term. Or,
Right.
We're going take out and take away, that kind
Yeah.
of thing. But
Yeah.
overall, I think basically it's another good, just like when we have a hurricane or anything else, it's another good dry run to kind of exercise it all. It's one thing to write it down on paper and be like, okay, I'm good. It's another thing to actually look at it and be like, okay, where are we at?
Right.
So
Right.
it's another good dry run to see where you're weak at and see where you're strong at.
Yeah, I agree. Next question here. How would a major natural disaster such as a hurricane or an earthquake affect America during the time like this? Well, we had an earthquake that was major in Salt Lake City last week.
Yeah.
5.7 or something like that. Listen, the biggest thing is going to be first responders are already spread thin.
Well, and the federal response has already
And-
kind of spun
right.
up to this, and they would be shifting gears. And then, not to mention, if people were
It's going to be
forced
limited.
to relocate,
Yeah.
that'd be a real issue.
It's going to be limited number of people able to help and limited supplies that they have to help with. That's really what, I mean, if FEMA was spread out completely across the country right now, and then they had to locate on
Yeah.
something like a Katrina or
Bringing them into
hurricane-
refugee centers or,
Yeah.
or what are they, school gymnasiums, that sort of thing. Yeah, that could actually exacerbate this
Right.
this whole thing.
Right.
So yeah.
So Walt wants to know, are you as concerned as I am about the Fed going full fiat with the dollar?
I thought they did that years ago.
They announced that they will print as much money as needed. I mean, it's
When you have the Federal Reserve buying T-bills,
yeah,
I mean, that's what's propping up the economy.
yeah.
They're pumping billions into the stock market every night, trying to keep it afloat. We see what it's doing.
Well, I mean, it's at 22,000 right now. So I mean, since the beginning, it's not even down. It's down about 20%, 23%,
It's
something right around there.
recovering and coming back. There was a lot of profit taking, and then
Yep.
there's also some pretty interesting conspiracies out there about what happened with that. But right now is a good time to buy if you're thinking about it.
All
But,
right,
you know.
take the next one.
Jessica asks, so if it's exploding in Florida now and it's hot and humid there, then the stuff we were hearing about it being heat sensitive aren't so accurate. I had read that heat and humidity killed it. Well,
Okay.
most of the cases that we're having in Florida and most of the explosions we're seeing here
Yeah.
are from all those folks from New York and New Jersey flying in.
Yeah,
So
yeah.
we appreciate it, New York.
Yeah, we
That's
like
most
it.
of 'em.
We like it usually about this time of year. They leave.
And yeah, and instead they're coming back and they're bringing COVID
Yeah.
with them.
Well, the exception to that was New Orleans, that they said Mardi Gras was a breeding ground for the pathogen.
Right.
So, yes, people brought it from other places, but now they've got a community spread issue that is likely to be a very serious hot zone in New Orleans, which has been reportedly diminishing hopes that the warm weather is going to abate the situation.
I saw the talk about New Orleans popping off, and we knew Mardi Gras just happened, but I wasn't sure if it was people coming from out of town that did that. It'll be interesting to see if that flare-up lasts or if it
Right.
burns itself out quickly.
Well,
Then
so far it is
then
lasting and it's increasing.
Is it increasing? Yeah.
Oh,
Okay.
big time.
Like
Yeah,
I'll say
big,
once
big.
again, and we try to use as many stats as we can. It was like 2 weeks ago, we had 11 confirmed cases in our county. 10 of them were travel related from other states. So if you were to take those 10 people and if they would have stayed where they were, we had 1 case
Yeah.
in Alachua County.
Yeah, now we're up to 46, and
Now-
we're also starting to get community-driven cases
Yeah.
that aren't just travel-related.
Yeah. So, I mean, the heat and humidity, kind of looking at the maps, there is validity for the most part with a couple of outliers, which are also very densely populated.
Yeah.
Besides those, it is kind of a fact that
And-
warmer weather is.
And we'll see. It's still cold in a lot of parts of the
Yeah.
country. I mean, it's really just started to warm up here, and we'll see how that.
Yeah.
If it acts like influenza A and B, it always dies off in the summertime, and we'll have to see if that holds with this one too. I'm going to take the next question just because I want to
Go
read
for
the
it.
name. Ma Kettle, I love that. Ma Kettle, have any numbers come out yet from those who have recovered that suggest any type of resistance built after exposure? Now, I had read one report out of China that they were seeing recovered patients coming back in 3 to 4 weeks later, reinfected. However, this time they were not contagious, but they were hit harder by the virus the second time. Now, does that mean that's everybody? That's the way it's going to be?
Right.
I don't know, because again, this was China. The fact they even released that shocked me.
Yeah.
But we'll have to wait and see. We're too early in this, I think, to tell if you have an antibody that'll keep you from getting it. But you got to consider, people get the flu every year, and some people get it every year.
Yeah.
And it's the same sort of thing.
And Jessica's pretty much asking the same question here. Any info on the folks that have shown reinfected overseas? So
yeah, China has showed that.
There are, and there's 2 strands. So I mean, some
Yes.
people that are showing reinfected actually have the second strand.
Yeah, there's L and S, and yeah.
Yeah. So it is possible, but there also are some reports that are showing that there is building up an immunity to it. Charlie, do you think a herd mentality will work here as far as trying to keep it at bay?
Well, that remains to be seen. That there has been some claims that yes, that's quite possible, but it doesn't.
Oh, we got little ones here now. Oh, that's my favorite girl.
The boss is in town.
Hi, sweetie.
That's us here. So there has been some claims that there can be some herd mentality, and there are people that are doing corona parties and all that other stuff.
Yeah.
But they're finding that that's a negative. You don't want to do that, because it's not about me. This is about trying not to get everybody sick and have to show up to the hospital, because so many people end up in the hospital at younger ages now than what was originally the case.
Anticipated, yeah.
Right.
Yeah.
That one's for you. Next one's for you.
Next one's for me. What's the updates on guns and ammo? Okay. Big Daddy Unlimited, we sell a lot of guns and ammo online. So I have a very good feel of where distributors are in America and manufacturers. We work with a lot of them. They're all fantastic people. As of right now, a lot of distributors in America are 3 to 6 weeks behind on shipping out orders. So instead of me being able, you take something like a pistol, okay? A pistol has to be 2-day aired from a distributor to an FFL. So usually if we needed something, 2 days, that pistol was at our doorstep and somebody could purchase it. Now that's 2 to 6 weeks before I get that same exact. What we're starting to see is orders are finally starting to get to the point where the panic really started. So most distributors are shipping from like the 14th to the 17th, somewhere around there. But it's literally going to take them 2 to 6 weeks to catch up on the last 9 to 10 days of sales. There is product, it's trying to get there. Companies, ammo companies, like Federal, Winchester are working triple shifts, 24 hours, 7 days a week. The biggest problem that they're going to start running into is being able to get copper, being able to get lead, the resources needed, because there's a lot of manufacturers that, a lot of like Pittsburgh, a lot of the Pennsylvania area, large material companies have been shut down. So you're going to see some more inventory come in, just because that's what's on the road pretty much from the distributor to the dealers, wherever you might live. The next wave is probably going to be a little bit slower, because now we're on that wave from the manufacturers are gearing up and trying to get it packed up. Then it has to be on the road to a distributor. Then it's on the road to a dealer. So that's going to be the next waiting period. It's going to be longer than it currently is, but companies are working as hard as possible.
Yep.
So take the next one.
Laura asks, what do you think of Thomas Lab fish antibiotics if needed later if things get real bad? Antibiotics don't work on viruses to start with, so there's no sense in taking any. But if you're looking as just stocking up antibiotics to have in case you need them for other things later, I'm going to kick it to Charlie, because I don't mess with the fish antibiotic thing. Charlie, you have any experience with?
Yeah, absolutely. So fish antibiotics, if you'll read Dr. Joe Alton's book on antibiotics, He's got one. I didn't have it. It's in my other library here, but it talks about when and how to use antibiotics, and it does cover fish antibiotics. And his research indicates that fish antibiotics are the same as human antibiotics if they're the same, if it's a straight antibiotic.
Right.
What you've got to be careful of is, so the president made comment about Coliquin, I believe, the anti-malaria drug, being something that you can use against COVID-19, and there has been some research supporting that in a fashion, but there was a couple who took the fish version of that had something else in it, and it killed the husband, and I believe the wife was in critical care just the other day. So when it comes to fish medicines, not all medicine is created equal, but fish antibiotics, like they have Fish Flex and Fish Pro and like Cipro and all that, those can be used, but I recommend that you do some research on that. Don't take my word for it. Go to doomandbloom.net and look up fish antibiotics. There'll be a lot of research there.
Yeah, I agree. Laurie wants to know, do you worry about verbalizing what you have? Do you think people will start to look at preppers? I'm afraid to say too much to people. Chris?
Well, that's OPSEC. I mean, you don't want to go around advertising that kind of stuff to just everybody, and that's for sure. If you're trying to build your mag, if you don't know what that is, Charlie's book is a great way to get started on that. And what's the title of that book, Charlie?
The Survival Group Handbook.
There we go.
He's got it right there. He's going to wake his kid up just to show his book. Good gracious.
But
that's right.
You shouldn't. There you go. Survival Group Handbook.
Here.
I actually have a signed edition of that.
Right.
But I wouldn't go
to see where this came from. You got to check out the Unraveling, because it was designed exactly the way this is kicked off.
Yeah.
There you go.
But I wouldn't go around advertising what you're doing. I would just tell people, no, we're good. The other thing that I'm trying to stress to people in the talks that we're having, we're doing nightly updates pretty much on this stuff too on my channels, is remember that as preppers, we have the opportunity right now to show that we are an asset to our communities.
Yep.
Check on your neighbors. Hey, is there anything I can do to help you? Is there anything you need? Maybe you leave your phone number with people, especially elderly people in your neighborhood who may live alone. Certainly check on them. I've got a good friend who's a cop in Texas, and when he got off duty the other night, he walked his entire neighborhood and handed his business card to every house. If something happens, call me. Is there anything I can do for you?
Yep.
It's a good way to meet people, get to know folks, and two, you might find out the more people around you are prepping than you realize, because they're going to be like, oh no, we're all set. And then you might be able to start that conversation. But I wouldn't go just announcing it.
Yeah, walk around your neighborhood. A lot of people are outside walking around more in the afternoon now. It's amazing. It's what we should be doing.
Well, everybody's being forced to slow down and live a little slower.
Yeah, I've talked about, I have an elderly woman that lives just near me, and I don't go to her and say, I have a lot of stuff. Is there anything you need? You can just ask questions. Is there anything you're looking for? I have a couple of things, or else I might be able to go get it for you. You don't have to tell them that you have food.
Yeah.
I'd be willing to go get you some food if you need it, and it could just be something that you walk to your house, put a couple things in a bag, and go hand it to them. You don't have to tell them, you don't have to tell people, I have food that you can have.
Yeah.
You can just say, is there anything I can help you with, or is there anything you in need of? I might be able to help you. We got a couple of things here and there. You can, but like Chris said, stay very vague.
Stay vague, and by reaching out to your neighbors and talking to people, you can also find out who are potential troublemakers in your neighborhood.
Yeah.
That intel gets passed around. You may not know that the guy 3 streets over is the one breaking into everybody's car at night, but the guy living next door to him probably does know that.
Yeah.
And so again, we're positioning ourselves to be assets to the community, and we don't want to be the guy that you come across my fence, I'm gonna kill you. We don't want to do that, because that's the image everybody has of preppers, and that's not what we are. We are an asset. We're there to help our communities and to help ourselves, of course. But by helping ourselves, we're reducing the burden on emergency services when the times come. But keep it to yourself, but ask some questions. Knock on some doors.
Take Panda's question here.
Panda, has anyone ever distilled alcohol? Can I make a purish alcohol from cheap vodka and use it for disinfection? You could probably use regular vodka for disinfection. On that note, I'll tell you guys this: if you flip over a bottle of Dawn dish soap and read the back of it, it kills COVID-19, it kills coronavirus, it kills all kinds of stuff.
Yeah.
And they tell you there's instructions on there on how to dilute it and make it into a conventional surface cleaner.
And that's what we've done.
There you go.
Yep.
Dawn
Regular
dish soap.
and water is all you need.
Yep, soap and water.
Soap and water is all you need.
Alcohol at all, it has to have more than 60% alcohol in it.
Yeah.
Some vodkas only have, like 40% or so.
You're not buying Russian vodka, are you, Charlie?
Well, I'm not saying it's the stuff I have. my Blanton's bourbon won't do it, but I mean,
But yeah, it's one of those things, guys. For disinfecting, I mean, yeah, we use palm olive dish soap. Have for a long time.
Yeah.
It'll dry your hands out some if you use it repeatedly, but it's going to take care of things.
Yeah.
So.
And you just basic soap, just soap. Any kind of soap and water does the trick. So.
All right. Kat wants to know, I live in a studio apartment. My fridge is basically a dorm fridge size with no freezer. Moving is not an option. I also have a limited income. What should I do? Stock up on
the basics of the stuff you eat now. Look for shelf stable.
Yep.
Canned items, dry packaged items. That sort of stuff. Do the copy canning method, which you've probably, I don't know if you've heard us talk about before or not, but when you go grocery shopping, if you're going to buy a can of chicken noodle soup, don't buy one can, buy the 4-pack.
Yeah.
Put a couple of them away. And do it a little bit over time. It doesn't have to be done all at one time, but every time you hit the store, pick up some stuff to put away in what you're going to consider your preparedness pantry. Just start adding to it. You are presented with some challenges, like you said, as far as fresh stuff goes. But there's a whole lot of shelf-stable food out there that will sit just fine in the cabinets, and start with that.
I agree. Is it possible that this virus was actually present during our regular flu season and some folks have already had it without even knowing it?
Yes.
Yeah.
yes.
Absolutely. A great many people have had it without knowing it. A great many people have survived it without knowing it. So, yes.
I would agree. Kenneth wants to know, how do you guys feel about the stimulus package? I feel like American people got taken from behind and given a candy bar in return.
Well, yeah, they're saddling us, our children, our grandchildren's children with debt. The Democrats want this helicopter money. They wanted it really, really, really bad. I think Trump had the right idea when he said we've got to support the workers, which we have to. We can't just put everybody out of work in this country. But you also have to support the industry, because if the industries fail, there's nowhere for these workers to go back to.
Yeah.
But I'm not a proponent of helicopter money to any damn body, personally. I know this is a hard time, and not everybody can afford to just stay home and not work. And there should be some kind of safety net for that. But, what is it, 2.3 trillion or something like that?
Yeah.
Those are numbers that you guys can't even fathom. Go Google up images, $2 trillion, and let it show you what that physically looks like. And which it doesn't exist in reality anyway. It's all computerized.
Take the next one here.
Earl says, my wife works at a store that sells feeds, so they are still working and considered necessary. Does anyone know what about workman's comp if she gets the virus? I know it's a legal question, just something in the back of my mind. I can tell you now, workers' comp ain't going to touch that with a 10-foot pole.
I'd probably say that. And this, like I said, we're not legal experts here.
We're not.
But packages, I think packages, this is just my opinion, packages like what's being presented from the president are going to make it also to where cases like this will not fall in a workman's comp or something. They will state it was already handled over here with something else.
Yeah, and I can assure you, having dealt with workers' comp before, they'll wash their hands of that and walk away. Tyler's asking, with more people being at home, are you guys seeing slower cell phone service, aka unable to make phone calls using cell towers? In my area, we are experiencing this. Yes. Seeing that, seeing slower bandwidth on the internet at my house too. So yeah, more people are, at home or not out. Like my daughter's on spring break. I feel bad for her. She has not left our house. She wanted to go roller skating one time, and I was like, ain't happening. You're staying here. She's a type 1 diabetic. not rolling this dice.
Yeah.
So yeah, we're seeing slower bandwidths on everything, guys, because so many people are using it.
And also in Europe too, they're starting to throttle the speed of Netflix.
The usage. Yep.
You
Oh, the speed of Netflix?
Yeah, instead of full HD, they're dumbing it down to SD.
So I wonder if Italy did that with the premium memberships to Pornhub that Pornhub gave away.
Probably.
Probably? Okay.
Now, I will say,
I just laughed when I read that on the news.
I will say, as far as like cell phone service goes, like your phone will still show full bars.
Yes.
It's just like when go to a football game, go to a rock concert, go to Disneyland, anything where there's tons and tons of people. It's just the ability to get calls out.
Yeah.
Because the lines are just being tied up. Now, if there is somewhere that your phone is not working, text messages
Generally do work.
generally will still work. So
Yeah.
use text messages over trying to call somebody. And the other difference is if the text message doesn't, it'll continue to try
It will
to
try
go through.
until it drops it. Yep.
So
And turn on your Wi-Fi calling.
Yeah.
That can help. Wi-Fi calling
In
and
your
texting,
settings.
That will help in your
And-
settings on your phone.
And if you're working at home office, you're trying to speed up your inside internet. A couple things you can do is try Etherneting your computer because Wi-Fi is going to be slower. So do a hard cable to your computer from your router.
yeah.
And I just heard where they came out and they said don't run your microwave when you're trying to get live streams or video streams because that can affect it without unshielded cabling and all, which nobody's going to have that
Right.
much of. So, and then if you're also rotate with who all the people in your house are online at the same time.
Yeah.
That'll give you a little bit of speed
Yeah.
boost.
When we do the nightly, I've been running a nightly a live for the last several nights, and I tell everybody in my house, get off the internet. I'll boot them. Actually, I got something that'll do that. So I'll kick them all off.
Parker wants to know, are there any states closing their borders? As of right now, the answer is no.
I had heard. Now I can't.
But there's not
trying.
one border closed yet.
Well, I had heard that a section of Louisiana and Mississippi had closed border. That section had closed down because Lake Charles had kind of sealed itself off because of all the industry there. They were being very proactive in trying to keep sick people from coming into Lake Charles. So I'd heard that, and that was from somebody there. So that's the only one I know of.
Take the next one.
Brett, I keep hearing that this outbreak is a red herring to prepare people for increased earthquake activity, being markers for Mount St. Helens blowing up. Is this just a conspiracy? Has anyone else heard this? I would call that the conspiracy of all conspiracies. in my
That's tin
opinion.
hat right there.
Yeah, that's some real tin hattery, because how does a virus have squat to do with Mount St. Helens blowing up again? And I haven't heard of any seismological activity at Mount St. Helens.
Yeah.
I have heard of some odd seismological activity in Yellowstone. There is a section of Yellowstone at the moment that is pulsing.
Nice.
It's rising and falling and rising and falling. So maybe they had Mount St. Helens confused with Yellowstone.
All right, we're going to wrap this up in about 15 minutes. We're going to take
Yep.
a couple more questions. We love each and every one of you. Thank you to the hundreds of people that are
There's
watching.
over 400 now.
Yeah, you
Great
guys
job,
are awesome. Make sure you like this video. Comment in it also. We'll try to stick around for the next couple of days and answer questions as we go. We're going to take a couple more here, 15 more minutes, and then Charlie has to go take a nap also. So,
When I go to do that, the baby will wake up. That's what's been going on here.
take the next one.
Will transitioning from extra sanitary back to regular life cause more susceptibility to illness? If so, should we ease back? We're taking all these extra precautions at the moment to avoid one particular pathogen. Okay, in your daily life, you come across all kinds of bacteria and other pathogens and stuff. I'm going to say no. I don't think that your immune system is going to be modified that quickly. Used to suddenly you're eating with clean hands all the time and that sort of thing. So I'm going to say no to that.
You're not going from being a vegan to trying to eat a steak.
Yeah,
and,
in
your
one
body's
day.
kicking it back.
Yeah.
I think
Like I
everybody
said,
that's stuck home with kids is going to get more germs brought into their house than they would normally.
yeah. I mean, like I said, I haven't really left my place much, and so I haven't been following these hand washing protocols and all this stuff at my house because I am not going anywhere, and I've been building things and doing stuff, and so yeah, I'm fine.
All right, Joseph wants to know, how realistic is it for the country opening back up by Easter? And will it still be bad by then? Nikki, when's Easter again? I forgot the date.
I believe it's the 26th.
26th? That's what I was going to say.
I'm
No,
gonna
sorry,
say
it's the
So we're
12th.
saying 4 weeks.
I'm saying Trump came up with that in the Oval Office by throwing a dart at a big board.
Charlie, concur?
Ain't gonna happen.
Yeah. There's no. I mean, it was just a date he pulled out to say that, and I think he did it based on economic numbers.
Absolutely.
He's like, by this date, we're going to be in real trouble if we don't get back to work. It has nothing to do with this virus. Its peak, the flattening of the curve, the flattening of its belly, whatever the hell you want to call it. No, I don't.
When Dr. Fauci did the face palm in the briefing, I think that gave the clue.
That, and then the chick, not the chick, excuse me, the reporter on Air Force One that asked him later, did you consult with any of your medical advisors or experts about this?
Yeah.
No, I just feel like it's a good time of year. It'll be nice by then. So
Beautiful time.
Beautiful.
Yeah.
The Easter thing. Listen, guys. I think there's a lot. I think President Trump has done a fantastic job of a scenario that's almost a no-win for whoever was in the office. Doesn't
no one
matter.
can do it right. No.
Doesn't matter. Republican, Democrat. Doesn't matter.
Well, until Cuomo becomes his challenger, because he's going to run all over Biden here soon.
Yeah, but the biggest thing right now is I think he has put out some dates that are hope builders.
He's
They're
doing
not more than that. Like when he started his 15-day quarantine 7, 8, 9 days ago, something like that. That was just a date that he kind of made. We're starting it today, 15 days. You take our county here in Alachua on Tuesday, Nikki, or Monday? Monday?
I believe it was Tuesday.
Tuesday. So we're on day 3 of our self-quarantine here in Alachua County. How are we done in 5 days?
Well, and yesterday our governor said everybody 65 and older should home quarantine. So that started their calendar.
Right.
All right. So these are arbitrary numbers, folks. They mean nothing. There's still people coming in and out of this country, crossing the state lines and everything. So the dates are arbitrary, and not to mention this whole 15-day incubation period is a bit of a fallacy anyway. It runs from 3 to 24 days.
Yeah.
Of incubation where you're asymptomatic. So it's a much broader window. And like John said, a lot of this is feel good. They're trying to keep the spirits of everybody up and not, there was a lady, I got a report yesterday of a lady walking through a grocery store, empty aisles, pushing and crying. And this guy, he's like, I felt horrible because she's like, what's the point of even living through this? Like, she was crushed. Yeah. But that's a whole nother discussion on mental health that we can have another time. But yeah, it's feel good stuff. So.
Take the next one.
Angry Vet, canning without aid of gas or electric, how can you gain max control over the heat to can stuff?
That's boiling.
Well, it takes practice, though. Yeah. If he's talking about pressure canning, that's a big difference.
Yeah.
And that's trial and error, building your fires and being able to maintain them as close to proper as you can. But what they mean, because I've seen it done, is essentially you have to stand at that fire. You're not going to set it on for an hour and go off someplace else and do something, come back. You're going to stay there and monitor it the whole time because that pressure goes up. You might be out back busting up more wood when you hear the canner go off and shoot over the house. So it just takes practice to get that touchdown. Big Ellison asks, general thoughts around whether people have really thought about the fact that 1/3 of the stock market is gone, and if we get going again, what it will look like. I bet it will take off like a scalded dog. My personal opinion.
I have said this. I'll say it again. Stock market was right at 30,000, 29,000.
Needed a correction.
When it really took off, it needed correction anyways for the most part because most of the gains that companies had weren't even based on numbers from the companies. It was just literally, it was a good market.
And it was stock buyback crap, which we've heard a lot about talking the last few days. So yeah, a lot of it was phony.
But I honestly think if we can get this handled by June, not Easter, not May, June or July. I think
I'm on August.
But if we could, June or July, I think by December, the stock market, or even by November, the stock market is back in the 30 to 35,000 range.
I predict by the maybe depends on when it stops. I'm looking at this lasting until August, and there might be an ugly August surprise.
So that's it. Go next.
Danny asks, how long past expiration date is food good for? How old was that Spam you were eating, Charlie?
The Spam Charlie in it was like 9 years old.
Yeah.
9 years past.
Well, the thing with foods, if you look at the cans, you have a couple of different date styles on them. You have a Julian date, you have a best by date, you have a sell before date. It depends on the storage. You got 5 enemies of storage. right? So you've got temperature, you got moisture, you've got insects, you got contamination, and you have
Light.
Light is the fifth one. So as long as you keep them all, keep all those at bay and properly stored and prepared for extended storage, you can keep cans of food for years longer than what the date is on the can.
Yes, much longer.
The can normally it says best before 2 years beyond is normally. You can go years beyond that. You might lose a little bit of the efficacy of the nutrition or the vitamin.
Well, that takes decades to happen to get to that point.
That's correct.
Yeah. Now, and Nikki put up a great graphic the other day, like on Facebook and Instagram, showing different cans. If a can is bulging, if a can is shrinking.
Don't open that bad boy up.
Things like that. There are identifications that you can see without even opening or sniffing or anything.
We were moving some of our food stores around, and we had a can of Augustin Farms tomato powder. Swole. I'd never seen that in a dry canned product before.
Well, they're acidic, but
it's very acidic.
Because I had an orange juice and pineapple cans, rupture because of the acidity, and they weren't even dented. But dented cans will damage the film that's put on the inside of the metal that prevents that corrosion.
Yeah, and going back to like movies like Big Daddy, dented cans are half price. Why? Because of that scenario right there. That's why stores will get rid of dented cans because it does break that film, which then releases it to the steel or whatever the can is made out of, the actual metal, and then you can start to have reactions to acidic products. So take the next one.
Sherry's got a tough one. She says, do you have any advice for nomadic people? Well, I don't know what exactly nomadic
Keep doing what you're doing?
Keep doing what you're doing. Stay 6 feet away from everybody. Keep on trucking.
Nomadic, is she possibly talking about RV campers?
Yeah,
because there was a big thing where they were shutting down campgrounds, and you've got a lot of permanent campers that have sold their homes and travel around in RVs, and they live in state parks, they live in private campgrounds, and all of those parks and campgrounds were told to close. So there was an online petition in Florida that says, hey, you guys don't realize that you're about to displace thousands and thousands of families and vehicles that live on the road and just travel the country in their retirement and everything else, because you're shutting down where they don't have dump stations for their campers. You won't have highway bathrooms, and all that kind of stuff. So that is a big problem.
There you go.
All right. So Ryan asks, have the symptoms of COVID-19 stayed consistent throughout this pandemic? I have heard about several different symptoms to look for, and I don't know what's
true and what's
and what was
false.
tin hattery. So the symptoms, I think, are pretty much the same. They're discovering some new ones, and that is they're seeing people come in to ERs presenting with just abdominal pain, and they run them through a CT and they get a shot of their lungs and they're like, COVID-19. And the virus, I'll tell you guys this, it has 3 phases to it. The first phase is kind of like common cold. No fever, you feel a little rough, you may have the trots, if you know what I'm talking about, diarrhea. Then you start to feel better and you think, I'm great, I'm over this. Second phase is flu-like, fever, you're miserable, you're in bed. You get over that, you think, I'm great, past this now too. And that's when the pneumonia phase comes in. And some people fight off the pneumonia phase, some do not. And all this talk of ventilators that everybody's making such a big deal about is for those people that develop what is called bilateral interstitial pneumonia, where they have to be intubated and on a ventilator to actually breathe, or they will suffocate in their lungs and die. So that's the best way we can answer that right now.
Well, there's also pink eye is a possible marker. Loss of smell is a possible marker. Gastrointestinal issues, like you talked about. And those are presenting as possible markers that would indicate that you might have it.
Okay.
Adam wants to know, since we're all self-quarantined in his area, where can I find plans for a shed that a person themselves can build?
Online.
Google.
Yeah.
The Goog.
Use your Google foo, man. It's out there.
Yeah, there's tons of schematics and plans for all different sizes and materials needed.
The virus.
But you can find it on Google, and most of them are free. All right, this is going to be the last question. Bird wants to know, I have a friend who is new to prepping and is in need of info on how he should start prepping now that this virus has hit. Do you have any quick advice for him or others just getting into it? I would say, first of all, become a Survival Dispatch Insider member. You can go to insider.survivaldispatch.com.
Get access to that library of information waiting for you.
We do monthly issues, monthly PDF issues. There's 70, 80 pages on one topic. So whatever topic you're kind of in need of, you can dive right into it in one place. Every issue is just, like I said, on one topic. So whatever you're kind of looking for, you can just grab it and read it and get as much information as you can. It's a fantastic way of increasing your survival library also. You can print them off. You can save them on SD cards if you don't have the room to print them off and store them. You can save them on SD cards. You put them on your computer, put them on iPads, phones, things like that. And you can check it out today for free for 14 days. So click the link that Nikki's putting in there. Also. So, and then the last thing is guys, for you guys, and Nikki's going to put a link to the germ warfare issue. Yes?
It is pasted.
Okay. Nikki put a link to our germ warfare issue. This is an issue that Charlie and I put together along with our writers at Survival Dispatch back in December, back before we knew what COVID-19 was. Yep. It was just on the docket for that month and we did it. So, the germ warfare issue is free of charge. You can download it, no 14-day trial or anything. You can download it, you can read through it. This is our way of giving you guys as much information as possible. And there's articles like you won't believe in there as far as just how to sanitize, everything you can think of with regards to germ warfare. That relates to the coronavirus. We didn't even know it was a thing back then.
Yep.
But you guys can check that out today. Thank you guys so much for watching. Anything else you want to add here?
No, we appreciate everybody that's here. You know, it looks like a lot of the people watching today were actually subscribers.
Yeah.
A big majority of you. So if you're not a subscriber, quit being a freeloader and hit that link, hit the subscribe button.
There you go.
You know, we've put a lot of work into this for you guys. There's a lot of money that goes in this. If you guys really could see the quality of the studio that has been built here, it's pretty amazing. I mean, these guys have put in a lot of work. I come up here once a week. John, Nikki, these guys, they're here all the time doing these things. A lot of effort goes into this. Oh, of course, Charlie, too. I always forget Charlie.
I hide back here.
Charlie's little one just woke up, so our boring talk of the day is over. So Charlie, if you guys ever can't put him to sleep at night, we'll just start a live.
That's right.
Put him right to bed.
It works for me.
It works for me.
So, guys, we appreciate you. Make sure that you follow us on YouTube, Facebook, Instagram at Survival Dispatch. Also, make sure that you follow Angry American on Facebook and Instagram
and YouTube and whatever else.
Charlie?
ReadyGoPrep.com.
You can check out more of Charlie's information as well. We appreciate each and every one of you. We hope you guys stay safe, and we will see you guys next week. Have a great one.
Until next time.
Ciao.